Adults need between 6 to 9 hours of sleep each and every night until they feel rested. But for people with insomnia, falling asleep can be a bit of a nightmare. Luckily, though, there's some new hope. A new type of insomnia treatment is gaining momentum. And joining us to talk about that, Dr. Mark Rosenblum from the Minnesota Sleep Institute. Nice to have you here, Doctor.
Thank you for having me.
Yeah, we were just talking about this with shift workers, especially with what we do with our crazy hours. It can be a problem when it comes to sleep, and I imagine that you see that with maybe people who you deal with who are shift workers who maybe have a little tougher time when it comes to their sleep.
Well, one of the things that we know about is people with shift work average about an hour less of sleep per night. And some of that can be related to the shift work, but also these are people that are at risk for developing insomnia symptoms in addition to just the lack of sleep.
Right. So for a person who has insomnia, how do they know if in fact they have insomnia?
Well, the most common signs of insomnia are troubles falling asleep or troubles waking up and getting back to sleep. So when people have chronic insomnia, which is an area that we're really trying to target, this is happening multiple nights during the week.
Gotcha. And what happens to our bodies when I know what happens to mine. I feel like I'm jet lagging sometimes. What happens to our bodies when we are experiencing insomnia?
That's a great question. When people have insomnia, they're at greater risk for developing things like heart disease, diabetes. We know our blood pressure elevates. We get more depression, more anxiety. And there's actually a growing edge of research right now that they're seeing the high overlap between people with ADHD diagnosis and sleep disorders like insomnia. And in fact, people often talk about one of the main treatments for ADHD are stimulants, and one of the theories that is now gaining ground is, well, one of the reasons these stimulants work is you're treating a sleep disorder.
Interesting, interesting. So let's talk about this kind of new insomnia treatment and what you've learned from this and how it's helping people.
Great, yeah. So we have a treatment called cognitive behavioral therapy for insomnia. And what that is a relatively short-term, mostly behavioral treatment that has a lot of research behind it. And from this research, we are seeing a shift in how people are now looking to address treating insomnia. Cognitive behavioral therapy for insomnia is as effective as the prescription medications without any of the risks of side effects or harm.
And so how would you go about treatment with using this kind of new methodology?
Well, we have two main components to the treatment. In one of them, we will actually intentionally shorten the amount of time someone spends in bed in a very structured way, and first try to stabilize their sleep, and then once they have stable sleep, we start stretching how much time they spend in bed. And another one, if anybody who has had kids is familiar with the whole sleep training process, well, we have another treatment that actually almost mirrors that. We are having adults put themselves in a bed when they're sleepy instead of maybe their young ones.
Interesting. I remember the girls when I first started this shift 10 plus years ago, and they used to think it was funny when they would tuck me in at night. They thought that was pretty funny. What are some suggestions for people who are suffering from insomnia that they can do tonight? And we talked about this, how we can make changes tonight to our sleeping so that we have a better night's rest.
Sure. Well, there's a handful that I will give people just on the front end if they don't have enough resources to do the treatment itself.
Sure.
One is make sure you give yourself adequate wind down time before you go to bed.
Right.
And stay off the electronics, stay off the iPad, and stay off the computer screen. Another one is people will sometimes try to force themselves to go to bed just because they're tired. And being tired and being sleepy are not the same things. So what I will tell people, it's actually better to wait till you're truly truly sleepy, which will increase the quality of your sleep, than to force yourself to go to bed just because it's a specific time.
And hopefully you can get into that good REM sleep where you're really getting the Z's you should be getting.
Yeah.
Right. Excellent. Well, thanks so much for being here, Doctor. Get information if people want to learn more. Minneapolis Sleep Institute?
Minnesota Sleep Institute.
I'm sorry, Minnesota Sleep Institute.
All right.
I need to get more rest. That's what needs to happen here. Thank you, Dr. Mark Rosenblum, for being here this morning.
Thank you. My pleasure.
You bet.